Hey, what's up? In this video, I'll be going over the routes of medication administration through RX script examples. And if you haven't checked out my previous video, this is actually part of a two-part series. I went over the parts of a prescription medication and I broke it down through medication abbreviations, which was awesome if you need a fresh review, so be sure to check out the first one. However, if you're new to my channel, welcome. My name is Tina, nurse practitioner. Don't forget to subscribe and turn on the notification bell. Let's get started. So the first medication is for inhalation. So it is Albuterol 90 mics. It is to be dispensed in 1 canister. The SIG is IH, which is inhale. 2 is the italic number. Puffs, PO, so by mouth. Q4 hours, which is the frequency. PRN, as needed. 4, SOB is shortness of breath. Wheezing or cough, and to dispense with a spacer. Sometimes some medications that are inhalers have to be dispensed with a spacer, especially if it's age appropriate and it's hard to be able to make that mechanism where it's in the patient's mouth and it's hard for them to inhale. Sometimes their tongue will get in the way, so it's easier for the medication to be dispensed in a spacer so that way the patient can easily inhale the medication. The next medication is your prednisone, 20 milligrams. Dispense number is 10 tablets. The SIG is 1 PO. So 1 tablet PO by mouth, BID, which is twice daily with, so we have the C with the line over it, mils times 5 days. So this is our old-fashioned PO route. The next medication is gel. So your diclofenac sodium. You're gonna see this a lot with your patients that have maybe lumbar pain, maybe cervical pain, and maybe more superficial like myofascial pain. They can apply this. This is prescription form, which has been converted to over-the-counter. You can pick this up at a pharmacy as well. This is 1% topical gel, 1 tube, 100 grams. You can apply 4 grams, so 4G topically, 2 times per day, PRN, for pain for lower back. The next medication is a Zalestine, which is for your eyes, for like rhinitis. The dosage is 0.05%, which is ophthalmic, 5 cc's dispense. So the order of the SIG is to instill 1 drop, which is GTT. OU is for both eyes, BID, which is twice daily. If it was specified just for the right eye, it would be OD, and OS is left eye. For the OU, I always consider there's like headphones over my head, and so that's why I'm able to remember for both ears, if that helps. The next medication is your Carbamide Peroxide, which is your good old-fashioned Debrox. They also sell this over the counter, so OTC is over the counter. 6.5%, and this is otic to defer for the ears. Dispense number is 15 ml, so usually comes in a 15 ml bottle. Instill 5 drops into AU, which is both ears, so AU. Right ear would be AD and left ear is AS. 2 times per day, PRN, for excessive earwax for up to 4 days. So it specifies the duration, so they don't want the patient to exceed the 4 days. Okay, let's talk about the NARS. So a common medication for the NARS is your Flonase. For your allergies, just like the runny nose, it helps with that. You have 50 mics, which is a nasal spray. You can dispense in a 15.8 ml bottle. Use 2 sprays, each for EH, NAR, or it can say nostrils, daily. And we are trying to avoid the QD, as I discussed on the previous video, just to prevent medication error. So you'll see prescribers writing it out daily. So reduce to 1 spray in each NAR daily when symptoms improve. The next medication is liquid form, and this one is acetaminophen. This is 160 milligrams. per 5 mils, and it's elixir. So when you see elixir, you'll know it is liquid form. The dosing is 118 ml bottle, and this is dosed for a pediatric child, so it does require a weight, and it is always weight-based for children, and so they always want you to make sure you include the kilograms. So this child weighs 23 kilograms. You want to take 10 mils every 6 hours, PRN for fever. Do not exceed 4 doses in 24 hours. So it's very important not to make sure you include the do not exceed amount, so that way there is a safety mechanism enforced. The next medication is your Lovenox. So this comes in a subcutaneous form. This is administered directly into the skin, and it is commonly given post-operatively for patients that may have had surgery. Let's say they're bedridden, they're not walking as much. Dispense 15 syringes, 60 milligrams, sub-Q, Q12 hours. So SQ is for subcutaneous, and the Q12 hours is the frequency of the medication that will be administered. Other medications can be like Q4 hours, Q6 hours, Q8, and so forth. And it'll specify specifically on the order. And if you see it on your MAR, and let's say, for example, you gave Lovenox early morning and then it shows up again at 12 o'clock, you should know to either one, you can redose it to make sure that it's 12-hour duration, or you can notify your pharmacy to redose it, so that way you don't give another dose of medication, as that can be a medication error. You also don't want to give this medication with patients that are on heparin. The next medication I want to discuss is your intramuscular injections. Some medications have to be given intramuscularly if the patient has maybe a lot of pain and they're seen in urgent care. For example, this medication is Toradol. So the injection is 15 milligrams. So 15 milligrams IM indicates intramuscular, Q6 hours, PRN, pain. Or if they're inpatient, they can be getting Toradol as well. So that's when you'll see a frequency. And in urgent care, it's like a one-time dose, and then they follow up with their provider. And number of refills in this circumstance was number 1. So this most likely is going to be seen in an inpatient setting for a patient admitted. Your next medication are your suppositories. This medication is called belladonna opium. It is dosed at 16.2 over 60 milligrams. This is a rectal suppository. Number 15. This medication is given especially with your patients that have had TURP surgeries. So they've had this TURP surgery and they always come out and they have a lot of spasms, a lot of pain. You could be giving them Dilaudid and nothing is doing anything for them. So this is actually a good medication to give post-operatively and works like a charm. So you will give one suppository rectally. So the SUPP is suppository, rectally, daily, PRN for bladder spasms. The next medication that can be given is solution powder. So you can always put the solution inside some water and mix it and stir it up with a spoon. So this is Miralax, 17 grams. So you're gonna give 16 grams, 1 bottle. So you'll take 17 grams PO, PRN for constipation as needed. And you can mix the powder in 8 ounces of water or juice. So sublingually, the next medication is your nitroglycerin. So this can be given sublingually in tablet form, which is 0.6 milligrams, and number 30, 1 tab. SL indicates sublingually. So this will absorb in your capillary system when you put it underneath your tongue, and it's every 5 minutes. Max dose is 3 doses, Q15 minutes. The next medication is your nitroglycerin, which is 0.4 milligrams per injection. This is spray form. So you can give 1 or 2 sprays, SL for sublingual, Q5 minutes, max 3 sprays within 15 minutes for angina. The next medication are your patches that you can apply topically for patients that have superficial, maybe low back pain or some form of back pain. So you can apply that to them. So this is lidocaine topical patch 5%, number 14. So 14 patches will be dispensed. The SIG is 1 patch to affected site times 12 hours per day, not to exceed 12 hours. So make sure you educate your patient that you take it off after 12 hours, and on the MAR it'll indicate that you do remove the patch. So that's actually very nice as a little reminder for medication administration. Alrighty, this wraps up my routes of medication administration. Don't forget to check out one of my other videos, and I'll see you on the next one. Take care.